Hello and welcome everybody to the Match Coalition July meeting. Happy summer. We haven't seen you in so long. It's great to see everyone. Thank you for those who've been sticking with us as we've been revamping our program and our content. Today we're actually outside of San Diego's Scripps Risley Sharp Medical Center. Sharp is recognized for its leadership and work in the area of cardiovascular disease prevention and treatment. So excited to be here today. But that's actually not our focus for today's Match Coalition. Today, we are honored to have members of the CDC's Division on Reproductive Health participating with us. I am also very honored to be with my co-host for today's program and co-chair of the HIMSS of Match Coalition from HIMSS, which is Valerie Rogers. Valerie, you want to go ahead and come on to camera for me? And if you haven't already, make sure you click the record button for me there, Valerie. So we've got that going, and we are live. This is a live recording. As you know, we like to make our sessions available for those in the event that they aren't able to join us for the program. So we'd like to thank everyone for today. Our agenda is exciting. We're going to first open it up with just a little bit of announcements. You know, that's your opportunity that if you have events that are going on in your community or on a state or national level that you'd like to make folks aware of, this is your opportunity. It's also the opportunity for us to encourage more participation. A couple of things I want to put out there as we start our announcements. The first is we have a study that's coming up, a research survey from which we would love to hear from you. We want to get your thoughts and perspectives on what data is being collected around maternal health. Is it working or not working? What would you like to see done differently? And how does it align or misalign to the goals that you have set for your organization for this year as well as beyond? So be on the lookout for that survey. It will be coming out to you today. The other announcement is that very soon, coming up in the month of September, we will be having our Innovation Month. So we will be inviting innovators in the digital health space, and not just digital health, but also innovation in new models, delivery models, maybe harmonization models, to come and talk with us about their approaches to addressing some of the persistent challenges that we still see here today in the maternal health space. So that's a couple of things that are coming up. Another important reminder is that August is our always traditionally the time that we take off. So there will be no Match Coalition meeting in the month of August, but we will be very busy trying to rally up folks to come and present their innovations and technologies in the month of September. And we hope that you will join us for that event and encourage others to participate. So with that, I'd like to open the floor. If you would like to share anything that's going on with your organization, or again, any events or programs or initiatives that you'd like to let others be aware of, this is your opportunity. Any takers?
We basically do a Medicaid birthday party. This year Medicaid is turning 59, and I'll put the information in the Slack. But as most people know, Medicaid started as a women and children's program, really supports more than half of the births in this country, and really in need of like additional birthing and reproductive health innovation and modernization. So I'll put the link in the chat. We celebrate on Medicaid's birthday, which is July 30th.
Adamika, thank you so much for that. We greatly appreciate it. That's a big milestone. That's a big number and really exciting. And can't echo your sentiments enough that there's so much more to be done. And what a great way to acknowledge and celebrate what has been accomplished, but also get revved up and ready to go on new innovations and new approaches. So thank you so much. It's an awesome reminder. We look forward to checking that out. Anyone else? Anyone else with updates for us today? All righty then. Well, we'll come back at the end and give you another opportunity if you decide then to muster up some things you'd like to present. We're happy to hear from everyone. But without further ado, I am now going to be passing over the baton to Valerie Rogers. Valerie?
Thank you, Fran. Can everyone hear me okay?
You sound great.
Okay, good. Well, thank you. I am very pleased today to have the opportunity, on behalf of HIMSS and one of our premier partners, which is working with Reach and Match. And as you all know, my colleague David Gray, who's usually here, is on vacation. So I'm really happy to have the opportunity to step in a little bit for him today, but also to press for really important opportunities to hear from our colleagues at the CDC around some specific ways in which we can begin to collect better data information around maternal mortality. And so, it's my pleasure to welcome Dr. Kay Charles and Dr. Lisa Romero. If you ladies could come ahead and come on up to the screen. We are so happy to have you here today. And I want to just give all of our participants, maybe if you could give us a 1 or 2 minute brief introduction of yourselves and what you do at the Centers for Disease Control and Prevention, Division of Reproductive Health. Lisa, would you like to go ahead?
Sure. Good morning, everyone. I'm Lisa Romero. I'm a health scientist and lead for our health services research and collaboration work in our division. I'm in the office of the director. I've been at CDC almost 19 years, and I lead a lot of our work around maternal mortality, postpartum care, contraception access, respectful maternal care, I have done a lot of this work that Kay will be speaking of, kind of holding things together until he came on board. We're so excited that he is leading our informatics work. And so I'm going to pass it on to him. Thank you.
Hi, everyone. My name is Coyote Alupinho. A lot of people call me Kay. And as Lisa said, I just joined the CDC, I think 6 months ago. So I'm still kind of like the baby of the house, if I'll call it that. And I am the lead informatics and I work in the same office as Lisa, work in the office of the director. And my job involves giving consultancy and monitoring the systems in the division. And we have, I think, about 6 systems right now. And before I joined, I was the director of health informatics and interoperability with the Texas State Health Department. So I'm happy to join Lisa and to do my best. Thank you.
Thank you, Lisa, and thank you, Dr. Kay. We certainly appreciate you being here. And, maybe one of the ways in which we can start the presentation, and I hope we will have like a really good dialogue, throughout your presentation. But could you give us a little bit, for those of us who are maybe unfamiliar with USCDI, what it is, and why is it important that we pay attention to this work?
Lisa, you want to go ahead or you want me to go ahead?
You go ahead, Kay.
Okay. So actually, it's part of my presentation to do that. And USCDI is called United States Core Data for Interoperability. And I'm going to use the word interoperability because, and I want to give an example. A lot of us probably know about this. So if you go to a doctor's office these days, you find out that when you go in front of the person that is going to register you, he or she puts it on the computer. Then the next thing he said, okay, can you wait and go to the doctor? You go to the doctor sees you, and he puts some things on the computer. the next thing he's going to tell you is, oh, by the way, Mr. A or Mrs. A, you need to go to LabCorp or Quest or whatever lab for tests. Now, before, what they do is they give you a paper. Now, these days, they do not. Now, how do you think your information gets to Quest or LabCorp? It's a computer A from the doctor's office, basically sending messages at the back end to computer B. And in order not to go deep, for that computer A to be able to send a message to computer B in Quest or even in your pharmacy, there are sets of data elements. So the process of sending that message is called interoperability. So US core data is trying to streamline and give a platform for EHRs, electronic health records or electronic medical records, to be able to communicate with each other seamlessly. So I think that's just a summary of what USCDI is. So it's a set of core data that EHR is going to be able to use to be able to communicate to each other, so that if you go on vacation to Australia and you get sick, and a doctor in Australia is asking, oh, by the way, I need to get your past medical history. All he needs to do is just to go into his computer, type some messages, and the record goes, the message goes to your doctor in whatever state you are in the US, maybe in Georgia or in Texas, and automatically your whole history goes back to the doctor in Australia. That's what interoperability is all about. So this USCDI is supposed to let EHR know what set of data that it can use to communicate with each other at the back end.
Awesome. And thank you so much, Dr. K. I really appreciate you taking the time to explain that. I know some of us here are more technical than others, and I wanted to make sure that we had sort of a baseline of understanding. And, without further ado, I'd like to just ask you and Dr. Lisa how you would like to move forward with your presentation. Do you have slides that you would like to present now? You have the floor is yours in order to share your screen.
Actually, we do not have slide ready to go right now. So what I'm going to do is I'm just going to talk.
Okay.
Because we have some protocols for sharing slides outside of the CDC.
Okay.
So I'm going to just talk, and Lisa is going to chime in once in a while. And after, if anybody has any question, please write down your questions. And like I said, I don't know the audience that is on this call, but I'm going to try as much as possible not to be technical.
Thank you. We're quite a mixed audience, and if there are any references that you'd like for me to share, either in the chat as you move along, I'm happy to do that. Or please feel free to insert any sort of links or references. And so let me go ahead and stop interrupting, and the floor is back to you.
So I just put a slide in the chat box. Not a slide, a link in the chat box. So if you can just open it up.
Okay.
And share it.
And share it now on the screen?
Yeah.
Okay.
Yes.
Absolutely. Can everyone see that?
It's okay, good. It's on. So this is the website for USCDI. And like I said, it is a standardized set of health data classes and constituent data elements for nationwide or what we can call either national or international interoperable health information exchange, like the example I gave. So USCDI has what we call data class and what we call data elements. And data class is kind of aggregated. If you can kind of like scroll down, please. Yeah, so it's aggregated into different classes. For example, that one you're seeing down there is allergies and intolerance, and it has set of data elements and domains for each one of them. Now, if I'm going to keep piggyback, can you scroll up a little bit?
Up, okay.
Just yeah, okay, that's okay. So USCDI has different versions. Now, I was still in the state when the version 1 started, and I think I was a member that started it. So, and each time we have different versions, different data elements or classes are being added to it. And I think I'll call on Lisa to give a historical perspective of what the CDC has been working on, or especially with a lot of other public health related affiliations until we got to the version 5 before the CDI Plus. Go ahead, Lisa.
Sure. So, and by no means am I an informaticist, I'm a subject matter expert. So this has been a lot, when subject matter experts from each of the respective divisions are asked, what are the important data elements that need to be included? And so, we get asked that on a yearly basis. Our divisions work closely together with other divisions or other centers to develop a list and then prioritize what we're going to put forward. And for us, for our division, we really focus on the maternal child health data elements. And so, as Kay said, what is important in terms of the research and the data that we need to help us understand and prioritize programs and policies related to maternal child health, and how best can we collect that information in a standardized way from the EHRs. And so our role has been from the beginning to really look at what data elements are in the current USCDI, and then put forward those data elements and use cases that we feel are important that are not in there that we would like to see standardized across. And for example, this could be pregnancy status, could be estimated date of delivery, it could be estimated gestational age, the pregnancy outcome, how did the pregnancy end, was it a live birth, a stillbirth, etc. And so we work closely to develop and prioritize those key data elements for maternal child health. And once we put them forward, they may or may not at the end get put into USCDI, whatever version. So we're back at it again, pushing it. And that's why it's so important during these public comment periods, which I know Kay will talk about later, to have support that the data elements that are being put forward are included. And we have come together to really try to align our voice within CDC for specific data elements. And we have found that prioritizing a few is much more helpful to get them into USCDI than having a long laundry list. We have our long laundry list and a lot of data elements that we would like to see in USCDI that are in USCDI Plus, which I know Kay will also talk about the difference between USCDI and USCDI Plus. But our work is really has really been to identify what those important data elements are related to maternal child health, how to prioritize those, and how to push a select few forward so that they are included. And then we'll work on our laundry list of others. And I'll stop there, Kay. And I don't know if I answered your question that you posed to me, but I'll hand it back to you.
Thank you, Lisa. So right now, like I said, there is a version 5 that we worked on earlier on. And I was, like I said, I was with the state then. So Lisa, CSTE, and some other folks, they really worked on it. And the final authority that decides what to be put on into any version is the ONC. And what I mean by ONC is the Office of National Coordinator for Health Information Technology. They are in charge of anything that has to do with either certification of EHR, interoperability, and now the USCI. Can you put up that website again, please, Valerie? Okay, thank you. So, like I said, USCDI is divided into different domain. When it started as version 1, there was no maternal health domain. In fact, there was no public health domain. Everything is on the medical side. But with CDC and other related organizations pushing, that's what is now called USCDI Plus. And USCDI Plus is just kind of like a step after the version 5, and currently right now, USCDI is not used for EHR certification. So what I mean by certification is this: every electronic health records, for it to be current with the ONC, they have to get certified. And right now, they're using version 3 for certification. So by the next version is probably going to be version 4, and then version 5. Then version 6 draft is going to come on, I think sometime this July. And that is going to be open for comments. So the USCDI Plus has a domain called maternal health. And Valerie, there's a second link I put there. Can you open that up? Thank you. Just the second link. Yeah. So this is the maternal health domain. And the US, so let me go into a second point of how it is used. Now, or how it's going to be used. What's the value of this? This is an opportunity for every public health practitioner that has something to do with, like Lisa said, maternal and child health, to make comments, to actually tell the ONC that, look, this data element, that data element is important for my job, for our job. Now, this is public health and even medical specific. Now, in terms of commenting, now every practitioner or every subject matter expert that has something to do with maternal and child health are required to comment by the CDC. By the ONC. So, like I said, if you can scroll up a little bit, please. Yeah, so, yeah, that's okay. So in this version, it has what we call, USCDI actually has what we call domain, then different data classes. Now, all the data elements we are going to be working with are in the maternal health domain. And they're subdivided into different data classes, which is then subdivided into data elements and, of course, the description of the data elements. Now, in the data elements, there are over 300 data elements. And basically what they're asking is, okay, as a public health practitioner or as a subject matter expert, wherever you come from, whether you are from the States, whether you're from whatever organization, how do you think this data element is important to what you're doing? So that's the comment they're asking for. But before we go deep down there, let me talk about what the CDC is doing from a CDC perspective. Now, ONC has reached out to us. We had a meeting, I think 2 or 3 weeks ago, and they talked about a lot of these, and they specifically want CDC to really be active to comment on this. Now, the procedure of ONC is that after the comments, like Lisa said, they're going to go and collate the comments and look at the percentage positivity of each data element. That is what they're going to use to populate the next version of the US CDI. Now, so what happened is that at the CDC level, there is a group called the Data Standard Management and Harmonization Group. Now, they are the ones that are going to collate all the comments. Now, out of this, we developed a subgroup or a subcommittee in which I am one of the, we're two actually, I am co-leading that subcommittee. And in the CDC, like we know, there are different divisions, there are different offices. So whatever office that has something to do with maternal and child health is going to be involved in this committee. We had our first meeting last week, and fortunately, Lisa was also in the meeting, and we are going to be commenting based on what we do. For example, I got an email this morning from somebody in immunization. He said, "Hey, you didn't invite me to your meeting. Hey, I also have something to do with maternal health." So I said, "Oh, I'm going to a meeting. I'm going to talk to you just after my meeting." So that's how the different people from different units and branches. Some are even in HIV. They have something to do with maternal and child health. So they are going to be part of the group of the, of the committee that I co-lead. And our job is to collate all the comments based on each of these data elements. Let me give an example. Now, what your cursor is on right now is author timestamp. And the description is date and time of auction. Of author action. So let's go down a little bit to average blood pressure. Now, I am an epidemiologist, or I'm also an informatics. What do I do with this data? Thank you, Valerie. What do I do with this data? Now, this data is in the class of vital signs. Do I, as a public health, from a public health perspective, remember the comment I'm going to give is from a public health perspective. Now, the comment a nurse, that is a maternal and child health nurse, is going to give is going to be a little bit different, because the person is going to be looking at it from a clinical perspective. I am going to be looking at it from a public health perspective that, okay, vital signs, is vital sign very pertinent in my data analysis work, in my epidemiological work, or in my public health work? So if that is a yes, then average blood pressure, obviously. Is this something that I need? Is it required for me to be able to make a good public health judgment? And things like that. Those are the kind of questions that is going to be running through my mind. And those are the things we talked about in our first meeting last week. So we are going to collate all these. And at the end of the day, the Data Standards Management and Harmonization Group, they're going to collate everything together from a CDC perspective and send it to the ONC. Now, that doesn't mean that it's only the CDC that's going to work on this. Everybody, as long as you have a username and access, and you have something to do with public health or even clinical health, you are required to comment on it. So I am going to advocate that every one of us, from whatever organization, maybe from an organizational perspective or even individual, try to go into it and comment because of the work you're doing. So that we kind of like internally, we have a Power App that we're using, and we also kind of like put up the data elements and the classes into a spreadsheet, which I cannot show right now. So I'm going to advise, and I'm going to kind of like ask everyone to comment as much as possible. At least not every data element is important. It may not be important to you. What may be important to me may not be important to you. but as long as you can, and you can, if it's not important, just leave it blank. You know, there are lots of it. There are about, I think, 362, but we looked at it and kind of like said, oh, there are 218 data elements that are important to us as the CDC. So there are a lot of things to do. Where we just had our first meeting last week, like I said, and we are coordinating all the submissions from a CDC perspective. And the Center for Medicaid is also commenting. There are a lot of each state's public health department is commenting, every hospital, everybody is required, every society. CST, I'm sure they're going to comment also.
Yes.
So that is just a summary of, so that I don't want to go too much technical, and there are ways to give the feedback. We can kind of like if it can go up a little bit.
And Kay, just to clarify, people are not required to comment. We highly encourage people to comment on data elements that are relevant and important to them, or they feel really need to be put into the USCDI or USCDI Plus, but nobody is required.
Yeah, you're correct. So just in a little bit so that I can kind of like, people can ask questions. Valerie, can you please, there is a link I just sent.
Okay.
Yeah, thank you.
Ready? So we're opening this one for the public feedback.
Yes.
Okay, yes, sir. Let's see. Let's share our screen here. Here we go.
Okay. So these are the rubrics. There are a lot, so that's why I don't want to read them. If you can scroll down a little bit, these are just the rubrics to use when commenting. So I think we have the link for everyone to just go through. You know, for example, let me just give an example of one each. You know, for example, under completeness and specificity for maternal health. Now, the data element you want to complete, you want to comment on, does the USCDI Plus or the Plus maternal health data set, does it contain all core data elements important for maternal health services, outcomes, and linking maternal health for infant and child? So that means that data elements that you want to use, or the data elements that you want to comment on, does it have that? If you can scroll down a little bit also. So that's another question here. The data needed to support maternal health care, outcome, and research. And there are a lot of questions under it. Can you go down a little bit? And of course, implementation consideration. For example, are there data elements in the USCDI Plus maternal health data set that might be too difficult to capture? And they are looking at it from an EHR perspective, because so when this data element is pushed out, there's going to be a code attached to it. And so when an EHR is building a maternal health model, they have to use that data. And those are the things that the ONC is going to look at when an EHR apply for certification. So there are a lot of them down there for healthcare practitioners, for research and public health, vendors, and things like that. So a lot of vendors are going to comment also. So like Lisa said, it is not a requirement, but is an advice for everyone to comment. And so all the feedback have to be in the ONC, with the ONC by July 31st. I think I should stop there. I know there's going to be a lot of questions, so go ahead, Lisa.
I was just going to reiterate that CDC is planning to put forward one comment. You know, in the past, different divisions, like Division of Reproductive Health would put forward a comment, Division of Heart Disease and Stroke Prevention would put forward a comment, Division of Birth Defects, etc. And we all in the comment may have said we support these data elements, X, Y, and Z, but now we're going to go forward with one comment with a unified voice, hoping that will give it more strength.
Yeah.
So a comment from your organization or other organizations that represent different constituents is very helpful and very powerful.
Yeah. So, and like Lisa said, the CDC is going to give one holistic comment, and that's the subgroup that I am co-leading. And we have between now and the 26th to do our job before we send it to the CDC.
So, Dr. K, in addition to submitting comments directly, would you like for organizations to submit any comments or like any priority items to you at the CDC? Or are you just kind of facilitating this within this larger process that the ONC has rolled out for us?
I think we like maybe HIMSS, your organization, to submit separately, because CDC is going to submit their own holistically.
Sure.
As one entity. So having other organizations will put a lot of support on whatever the CDC does.
But it might be also helpful, yes, absolutely agree with Kay, to know what your priorities are, and that could help us prioritize our list also, because we have a set of priority data elements that have been informed from our work and the work of our partners. But that is also very helpful if you see something that should absolutely be included and it aligns with us. I mean, we could really push more for that. So any information to help us prioritize our list also is helpful, but having your own separate comment would be, like Kay said, very helpful.
Yeah, because I'm just wondering if there's anyone on the call now representing the maternal mortality review committees, mainly based at the state level. I'm sure a lot of this would be of interest to that community, just given a lot of this data should help direct or support specific aims and goals for reducing maternal mortality in the state. So in terms of quality improvements and the work that review committees have to do, I'm assuming a lot of this information would be very pertinent. So it's important, although it seems there's a lot there with 300 elements. It's really important for the community to really sort of stand up and take notice. Lisa, any additional thoughts about that?
Yeah. So I know that it is overwhelming with that many data elements, but as Kay, you saw the screenshot and there was vital stats, this and that, but there are specific domains like maternal mortality, pregnancy information, postpartum. So my suggestion would be, if your subcommittee is working on maternal mortality, to really focus in on the maternal, or it's the mortality data elements. And there's a handful of those that include cause of death, mortality indicators, and really focusing in on those few, because, even when I scroll through that laundry list, I am only pulling out those data elements that may be relevant to the work that I do, or that I feel comfortable commenting about. Some of them are, very important, but that they're not necessarily something that I would comment on. I would leave that to those SMEs in that area. So, it's easy enough to kind of focus in on those data classes, data elements, in terms of the priorities that the maternal mortality committee may have, and looking at what those data elements are. If they capture is there anything missing? Is there anything else that would be important to capture in the EHRs to help inform the MMRC's work? And, all of that. And even if, I'm not an informaticist, but I know as a SME, to identify data elements, then we can work with others to identify, what are those codes? How could we pull that from an EHR and such? So there's other people that can work on that side of it, but having some folks look at the list and say, yes, these data elements are important, or these are missing, is also very important.
And just to add to what Lisa said, if there are data elements that are not included that you feel as a subject matter expert that needs to be included, please comment on it also. Like I got one this morning from one of our programs that they said they need one data elements to be included. I said, okay, we're going to work on it also. So it's not an overarching thing. It's open for different kind of comments. I don't know if anyone has questions and comments on it.
Yes, please feel free, either raise your hand or just jump in here, or you can ask your question in the chat. Any additional questions? I actually do have a question. You know, a lot of what we are struggling to tackle has a lot to do with social determinants of health and health equity. And so could either of you kind of address maybe with relationship, of course, to the work you're doing with USCDI and capturing some of that information, but also I think generally in your overarching work, how that sort of factors in how we respond to the maternal mortality crisis in the country.
Yeah.
Thoughts there?
So those are also, social determinants of health are also very important data elements for us, and to be able to collect those. There is a category, I believe, it's like health status assessment. I could be wrong by the exact terminology, but they do ask things such as employment status. They ask some social determinants of health questions in the assessment, and you know, reviewing those data elements that are included in that section, seeing, is it comprehensive enough? Are there other data elements that should be collected is important, because there is a number. I'm scrolling through a different spreadsheet, but you know, there's also health status assessment, work information, patient demographics. So there are some data elements that are important to collect that could provide us important information on social determinants of health. So that is absolutely, those data elements are critical to be included. And not only in the maternal health class, but there's other categories that we want to make sure that they're consistently included in. I know that the maternal health is one category, there's public health, there's, I think, behavioral health. And so there will be some overlap and cross-sectional overlap, but I think it is important to ensure that we are capturing those social determinants of health.
So, yes, Lisa, and just kind of to add to what you said, there is going to be, I think, as part of maybe a version next to come, health equity. You know, so is going to be included as a class that is going to cover the different domains of the data class.
Great. And you do have a question in the chat from Fran. Fran, I don't know if you're able to come off of mute and ask your question. The question is, what resources are available to help healthcare providers and social services agencies implement the USCDI Plus recommendations, and particularly for smaller or under-resourced practices?
Yeah.
Go ahead, Lisa.
I could speak to that a little bit based on, you know, some work that we have been doing in our division with health centers, with a number of health centers, community-based health centers across the U.S. We have a project with the National Association of Community Health Centers. It's a pilot project that is really looking at clinic workflow. Are clinics incorporating evidence-based recommendations into the clinic workflow related to pregnancy and postpartum care? And then looking at the data workflow, how are we capturing those important data elements in the EHR, so that we can then look at the data that can inform quality improvement in the services. And so we've had to do a lot of work. It's been very interesting. We just finished a 6-year project of, these are the basic data elements we want you to collect. Could they collect them in the EHR? Were they interoperable? Were they standardized? And so we had to do a lot of technical assistance with these health centers and their health center controlled networks to be able to standardize the data elements, help them collect this data, to be able to extract the data and then use it for quality improvement. So there are some resources available in terms of technical assistance, in terms of projects that have been done that have tried to address this, because resource limited practices, it's a lot on the infrastructure and a lot on staff time to be able to do this, not only to implement clinical services, but then be expected to be collecting important metrics and use that for quality improvement for their patients. And so I can drop in a link to a recent paper that has just been published on the SNAC project, but I think there's going to be more and more focus on helping smaller health centers, clinics, communities, take this type of work and how to implement it and what they need in terms of technical assistance. I'll drop that link in. Let me find that link and I'll drop it in.
Yes.
Go ahead, Kay. I don't know if you want to add anything.
No, I just wanted to mention that NAC walk you mentioned, but yeah, you already mentioned it. And also there is I think like this is a pertinent and a very important question that you've asked. So I think there's going to be a lot of discussion more on especially how under-resourced practices can kind of like link into this, and especially with regards to the EMRs or the EHRs they use. Because right now, for EHR to get certified, they have to be able to get certified per version 3. So they're not even in version 5.
Mm-hmm.
Yeah.
That's really important to know. And, Dr. Lisa, Dr. Kay, I want to thank you so much for really giving us sort of more detailed information about how this can impact our work. As I mentioned, we come from a variety of backgrounds through the Match Coalition. Some of us are advocates, and I would be remiss without at least giving you sort of a last word in terms of, what you will continue to prioritize, both with regard to these data elements and the work with the USCDI Plus, as well as we continue to push forward with transforming the U.S. health system. Much to do about data modernization these days, with a lot of concentration and focus at the state level, which, often is where the rubber meets the road. So if you had any sort of last departing words, given those of us coming from different backgrounds and who have prioritized this topic, either through our work and just through our advocacy, what would be your sort of final, I guess, maybe marching orders or things that we should consider in our work moving forward in relationship to what you've laid out for us today?
I think that since y'all are from like different backgrounds, I think number one, it's very well, it's advisable to help comment on some or all of the data elements. Now, there are use cases of these data elements. So if you can kind of like in the in ONC website, go into the use case, and all you need to do is, okay, what concerns me? Maybe let's just say you are from a social services agency. What concerns me? What data concerns me? Because at the end of the day, maybe in the next 2-3 years, if you're doing your research, you're going to need data that is pertinent to your services. Or maybe you are a health research agency, you're going to need data. So, and if you don't make comment, and EHR may say, oh, ONC, we don't have that data because ONC did not ask us to, I mean, just an example.
Mhm.
So I think, Jen, I'm going to advise that we all just go in there and look at use cases, look at data classes, look at the different data elements. Because, for example, there's a data element on substance use, so that is related to maternal and child health. I think some agencies that are into that would like to comment on that. Oh, by the way, blah, 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 like that. So that's just what I will advise on.
And for me, as I said, I'm not an informaticist. I'm not, I got pulled into this work, but I'm more of a subject matter expert. So, when I got pulled into the USCDI work, I was like, what is this? But I think it's really important that that these data elements are standardized, that we are able to collect meaningful data, and that we can use, health information technology strategies to extract that and inform our quality improvement for practice. I think, at the implementation level, it's really important to understand that to be able to do that, we need these standardized data elements. And so taking the time to really think about what are the important data elements that we need, what is missing, and how can we push forward to get those is really important. It seemed so abstract to me when I first got pulled into this work, I'm like USCDI, like all this stuff. But when you're at the clinic level and you're working with patients, I mean, it really is critical to improve the quality of patient care, to be able to collect this data in a meaningful way, have standardized data that you can compare to others, and to be able to use that to inform your care. So for me, like when we work with the health centers, it seems so abstract at times, a lot of the language and the terminology that we use in this. For me, as I said, I'm not an informaticist, but it is so important in terms of improving patient care in the maternal child health arena, to be able to have these meaningful data elements that are standardized and be able to collect this data, extract it from an EHR and use it easily. It shouldn't have to be so complicated.
Well, absolutely. I think the big takeaway here is data is elemental, especially in this work. And, HIMSS is very much in the process of working to collect comments around the USCDI plus maternal health elements. And if there are those on this call who are interested in providing comments or, adding, just your thoughtful input around, what may be a priority for you, we'd love to hear from you. And as Fran has mentioned, we also have a survey coming out that does also touch on this. So we're hoping to hear from you both via email. You can feel free to email me. I'll put my email in the chat. And, how can we get in touch with you, Dr. Lisa, Dr. Kay, afterwards, if there are folks that want to reach out and learn more about your work there at the CDC? Is there a way in which we can reach you directly?
Yep, I'm putting my email in the chat. Feel free to email me directly, and Kay, please put yours in also.
Awesome. And so with that, I want to hand the reins back to Fran.
Yeah, thank you so much. Before we close, I just want to make a remark. I'm really excited about the information that was shared and the efforts that are being made. I have to say, as a a non-for-profit organization that has not only that we do research and education and thought leadership, but really on the front lines. We have a very involved doula service, full spectrum doula practice, and I can't help but begin to think, how can we better leverage this data? So I really am excited about the idea that in the future, perhaps between the CDC, ONC, and other entities, that we could work to identify ways to make for more practical applications of the data. Certainly, as a public health professional, front of mind is data gives us the insights to refine our services, to redefine and to refine the education that we extend. But I think there's a lot that perhaps needs to be done there to demonstrate it, such that others will feel more confident in how to leverage this data. And subsequently, once we have them in a place where they begin to consume it, undoubtedly they'll be more better positioned to provide comment and feel more empowered, right? And emboldened to provide comment because they've started to really see its value in their practice. This is where we begin, though. So thank you so much, Dr. Lisa. Thank you so much, Dr. K. It's been amazing. We are excited to help promote your efforts to get the word out and encourage folks to take a look and provide contribution, particularly around those elements that are social service or social determinant related, as it is recognized as being one of the most instrumental elements and really transitioning, right? Moving and progressing into a more evolved place. Thank you, everybody, for your time today. Remember, we are not having a session for August, but we will see you in September for our innovation showcase. Thank you, everybody.
Thank
Bye-bye.
you.
Thank you. Bye-bye.
Lisa. Thank you, Kay. We appreciate you.
Thank you.
Okay.
All right.
Good, friend. You okay?
Yeah, it was great. I always like to give people a second. I'll call you on the line.
Hey, Fran, I had
Bye.
a quick question for you about your doula thing.
Hello. Yes. Hey.
Can you tell me a little bit about what you guys are doing with doulas? 'Cause we're
Yeah,
doing a ton of doula-related work, and so I would love to plug you into some states or.
Yes, absolutely. We have a full spectrum doula practice. So we're delivering services across California. We're credentialed with, Medi-Cal and all of the MCOs and with TRICARE and some of the commercial providers as well. But as a non-for-profit, we emphasize, there's still going to be those who are indigent. So we make sure that everyone who needs access has access to the service. And
So where do we get access to this information? Because we know Sister Web, we know all sorts of folks across the state, but had no idea you guys were doing this work.
Yeah, we were one of the first ones ever credentialed. In fact, we were like one of 3, and we've incorporated ECM with community health group in Molina. We're one of 2 or 3 for them as well that provide ECM for birth equity. I guess I keep our heads to the ground and we're just moving and not really at events shaking hands.
Where do we get more information to kind of help push that forward? And
well, our website is happymama.global, but I can send you some additional information and we can also set up some time to talk. I'd love to do that.
Yeah, I would love to do that and see how we could be supportive, because we have been a part of, I mean, obviously I'm deeply enriched in California, but we do work around the country. We were the ones behind the governor of New York putting out their doula mandate a month and a half ago. We've been working with 7 hospitals across the nation.
That's awesome.
So yeah, please let us know how we could be helpful.
That would be amazing. I would love that. We do have some of our staff now is based in New Mexico and Texas. So our vision is, really get a stronghold in our backyard, California, and then we're heading east, going across, especially already with the work we do with TRICARE. So it's a very, very doable thing for us. We're just kind of making our way. So I'd love to have your support.
Yeah.
I'd love to share more with you for sure.
Please let me know how I can be helpful.
Absolutely. Thank you. I
Okay,
thought it was a
bye.
good call today. What did you think? Did you,
Yeah,
yeah?
it was, it was a very untraditional CDC call, but it was good.
Oh, yes, this is true.
Good to see you.
But we keep poking them, we'll do well. Yes, safe travels. Okay, drive safely.
Okay, you too. Bye.
All right, bye.